Good morning, good afternoon, good evening from whatever time zone you're dialing in from. We do have one other panelist that we hope is joining us, but we will start the session now and hopefully she will join us. My name is Steve Hamill. I am the Vice President of Policy, Advocacy, and Communications at Global Health Organization Vital Strategies. In two cities you'll hear from today are part of the Partnership for Healthy Cities, which is a global network of 70 cities that have committed to reducing non-communicable diseases like cancer, diabetes, heart disease, along with injuries. And for 5 years, we've been supporting cities in making public areas smoke-free, for instance, or removing soda ads from schools and so on, in a program that allows cities to pick their own policies best suited for their populations to improve population health. And Vital Strategies does this in partnership with the World Health Organization and with funding from Bloomberg Philanthropies. One of the challenges we've seen over the last 5 years that keeps emerging for cities is how to make health policies more effective and also more sustainable so that cities aren't back to square one or the beginning every time a new mayor is elected. And too often we see good health ideas sit on the shelf, meaning they've been conceived of, but they never get implemented because they're missing a critical piece. Maybe it's political will, maybe it's great data, maybe it's resourcing. So a few years ago, a year or two ago, we added a program that we call the Policy Accelerator. This takes cities through a step-by-step training process under the guidance and with the support of global experts, and cities walk through this process based on their own needs and their own resources and talents. And the networking involved in the partnership, the peer-to-peer learning is a big plus as well. Today, you'll meet two of the cities that are currently enrolled in the partnership's Policy Accelerator. I'm pleased to be joined by Luis Soboya, who's the president of the Foundation for Science, Technology, and Innovation from Fortaleza. And we also hope to be joined on stage by Dr. Marie Emmanuel Zur, Director of the Prevention and Control of NCDs in the Ministry of Health in Ouagadougou, Burkina Faso. Thank you so much. I'll ask, first, the format is we will ask each city to present a bit about their issue, and we'll learn from them, and then we'll have a discussion. So Luis Soboya, over to you to share about Fortaleza's journey.
Thank you, Stephen. Just a moment, just to share my screen. But good morning, everyone. First of all, I'd like to thank you for this invitation, this opportunity to be here sharing this program. And I'd like to thank especially PHC team and Policy Accelerator program. So I'm going to give you a short presentation about a very important topic in the city. But I'd like to present my colleague Cassiano, who is here by my side. He's the team leader of this project. So our case, it's about policy designed to prevent and to monitor and to prevent diseases caused by air pollution problems. So the first thing I have to say is that it's a very critical problem in the city. According to this graph, we have almost half of total natural deaths in Fortaleza potentially caused by diseases related to air pollution. It's a very critical problem of the city, despite of the fact that we don't have the awareness about this problem. This is a very good challenge for us to face. Fortaleza is a 2.7 million inhabitant city and the capital of the state of Ceará in the northeast of Brazil. And we have just one monitoring station in the city, and we use this station to calibrate and to validate our equipments and our policy. And as I said before, we have a very big problem to face. That is, the air pollution problem is not perceived as a health problem by citizens. So we have to be able to build awareness around this topic. Those are data from satellite estimates. And according to those data, in the past 20 years, we always have air pollution rate higher than the maximum rates established by WHO. So this shows the size of the problem in the city. But as I said before, the inhabitants don't have awareness about this problem. And each year we think that we have average like 440 premature deaths potentially related to air quality, air pollution problems. So we designed under this approach, under this policy accelerator approach, we designed a policy solution based on 3 main pillars. The first one is to have a low-cost air quality sensor network. So the equipments were developed in partnership with a local university, the Federal University of the state of Ceará. And the second pillar is to establish a surveillance system in Fortaleza. We need to have metrics and indicators in order to monitor the evolution of the rates of pollution in the city. And we have to have a special focus on children and elderly people. And the third pillar is to establish a strategy on how to create awareness in the population. So it means we have to have a very strong advocacy strategy and communication strategy to create awareness in the population. Maybe this is the main challenge that we have to face. This slide shows us just a picture of the equipment. This is the low-cost sensor. We're going to have 25 sensors like this distributed in the city area. And here I'm not going to comment each one of these phases, but just to show you the big picture of the phases that our program has. And we have some phases related to legal questions like laws and decrees. We have technical issues. We have communication issues. And just to finish, I'd like to highlight just 3 or 4 points that I consider that are key factors to get successful in a policy like this. First one, I think it's very important to deep dive in the problem. It will be able to establish the relation between this topic, this issue, and the daily life of the population. This is very important. The second one is to have a very good technical team in order to deal with this need to deep dive in the problem. The third one is to be able to create leadership around the team, around the topic, and to engage other agencies and departments in the city. And the fourth one, and maybe is the hardest to face, is to create awareness in the population around the topic. So to summarize, this is our project. Thank you very much.
Thank you, Luis. That was a great overview of your project. And it looks like we may or may not be joined by Dr. Zor, which gives us the opportunity to learn a lot about Fortaleza, to experience and really dig in. I thought it was great how you, even very briefly, you highlighted that to succeed, you need to be able to work on a number of different dimensions, a technical area to build public will or public support, to build that technical team that knows how to really answer and build the awareness. I'm curious about what happened, preceded what happened before this policy of implementing air sensors. Was there work or a situation that was preceded this work that helped propel this policy forward?
Okay, my colleague Cassiano is gonna answer.
And we had a reference monitoring station, and for I think that 3 years, and this is important to help us to disseminate the idea, the importance of the problem, and it has important role in the calibration process and validation of the low-cost monitors. And along the path, we try to engage the other secretaries, mainly the health secretary and the environmental secretary. We design all the policy with the help of the stakeholders.
Really interesting. And I'm going to start, if any questions come up in the chat, I will incorporate them here. One of our colleagues asks, will the monitoring lead to policy changes to lower exposure through, for instance, a low emission zone, in addition to using data to create public awareness?
Okay, and our network is the first step of our effort. So, and we don't able to think about low emission zones, for example, for now, but we think that after the network is implemented, we will be able to think about the solutions like low emission zones.
Yeah, I think it's a step-by-step process. And once you have this network established, maybe we're going to use this set of data and to implement new policies like low emission zones and things like that. It's a step-by-step process.
Yeah, I love how you acknowledge that the data is just the first component, right? And the data you will use to drive public awareness. And then once you've built public support, then that creates the demand for something like a low emission zone, right? Because a low emission zone will potentially require different behaviors from citizens, or, can you talk a little bit, have you thought about how you drive this public awareness? Will it be through, media campaigns, or will you use this data out to speak with journalists, or what might the awareness raising component of your work look like?
I think we can think about a lot of different ways in order to have this. One of this is to have public panels in the city, electronic screens in the city, in public spaces, to communicate to the population about the air pollution levels. So it's a novel thing in the city, and maybe people are going to be curious about this. The second one is to organizing seminars and meetings with the specialists and journalists in order to have this topic disseminated in the city. But as I said before, I think it's a process, step by step, and you are completely right. You have to start this by having the data. If you have the data, you can establish the next steps.
I'm also impressed by the fact that you were able to successfully engage other ministries and other groups. We often see in this work that a new health policy requires maybe support from a Ministry of Finance or Ministry of Transport plus Ministry of Health. And often, sometimes people don't get the support they need, and a policy will just kind of, sit there waiting to be implemented. What did you do to get partnership from the other ministries or other departments and kind of civil society? How did you persuade people to come to the table and support this?
And firstly, when it was a challenge because, as Luis said in the presentation, it not perceived as a problem in the city, but we get satellite data, for example, and we estimate and the depths related to air pollution as shown in the slide in the presentation. And after that, the other actors sensibilized about the problem. The first then was the environmental agency, the environmental secretary of City Hall, and after the health secretary of City Hall. And we are developing our policy with the support of those two secretaries, but after as an action of communication access, and we'll try to get other secretaries, other actors, and for example, environmental educational access, we'll try to do it to teach for children's at the schools the importance of the air pollution situation and in the city.
Yes, and just to add a point, I think the main way that we have to create this kind of engagement is to show our partners in the city staff the real dimension of the problem and its consequences on the daily and concrete life of the population, and how many lives we can save using this kind of approach, how much we can save from the public budget. So I think that real arguments like this, it's very important to convince people.
Yeah, I think you're pointing into such a important dimension of how we make success in public health, right? The data and the public awareness and the political will are all interconnected, right? Like you need to have one, it's sort of a virtuous cycle or circle that each one informs the other. And I love that you mentioned the importance of the budgetary impact or the fiscal impact of this policy. We know in government that's such an important driver of creating a priority around your issue. Can you talk a little bit more about the fiscal impact or how you conveyed that impact to some of the other stakeholders?
Can you repeat fiscal impact?
Yeah, I'm wondering how you used the notion or the idea of budget impact, future budget impact, to create other champions in other.
Yeah. And after the implementation of the network, low-cost network, we think that we can convince and other secretaries and the people at all, and we think that we will be able to put more low-cost monitors around the city, for example, to detect hotspots around the city. And after this first phase, and then convinced the other secretaries, other actors, we think that we will be able to get more budget, more money to turn a policy more strong, I think.
Great. And what advice, let's say another city was looking to implement a strategy like this, what advice would you have for them, like how they would approach, how to approach this, how to start this process?
What
I have I have two or three points to give as an advice. First one is to look to other cities, to learn from other experiences. It's very important. The second one is, as I said before, is to have a very good technical team and to deep dive in the comprehension of the problem and to establish the correlation between the problem and the consequences in the concrete and daily life of the population. And the third one, don't give up. It's difficult, but you have to moving forward. So that's it.
I love that. And that in that last point, were there some obstacles that you encountered? Can you share a little bit about that?
Yes, a lot of obstacles. Like as I said before, the barrier of not having awareness about the topic. It's a very tough barrier you have to face. To convince our colleagues in the municipality staff, it's a very difficult task also, but we are doing very good progress. We are very optimistic about the future.
Yeah, it seems like you're proceeding very methodically and well. And how did this idea first come about? Was there a first piece of data, or what was the first component that gave you the energy to work on this idea?
I don't know if I understand the question, but for a personal perspective, for me, the main component that convinced me to go into this project, it was the real dimension of the problem. Because before I had the opportunity to work, to deal with the policies related to road safety issues, for example. And I knew the impact of the traffic accidents in the life of the population, but I didn't know how do I say this?
the impact.
The impact of air quality issues, and I was very surprised because it's very impactful. So for me, it's dealing with this problem. It means we are dealing with the life of the population, saving lives in a very direct way. So for me, in a personal perspective, it was very important.
What was a surprise for us when we found 4,040 deaths related to air pollution after we put the satellite estimates and deaths numbers in the RQ Plus tool, and we found this number of the deaths related to air pollution. It was a surprise for us. We think that it was a minor number, a less number. For 4,040 deaths, and is a lot of deaths.
I love that you mentioned the satellite images. I think they're so persuasive, right? Because they really convey, or the problem at a glance. You to really understand, but that also takes some additional technical ability to be able to generate those satellite images from the data. Do you want to talk at all about some of the technical challenges you had? Did you have to bring on new types of people with different skills as you were growing the project? Did you learn about different technical abilities that you needed to pull into the project? What were some of the technical challenges?
Here we are so lucky. We had a data specialist, and he got the estimated satellites and generate these images for us. But I think that the mainly technical challenges for us was a developed team to create the monitor. And in the Federal University and Transport Department, and we have a professor that have been work with this team and since years ago, and he has a developed member to help us to construct and developing and code and the structure of our low cost monitor. I think that the other cities that wanna and work with this team, and this is the mainly technical challenger. This is a develop of the monitor, or we source to buy other type of monitors because it was expensive. And
that's impressive. So you built some of the monitors yourself, but you also purchased some of the monitors.
Important for us develop this technology, this local technology is important for us.
Wow, that's really interesting. Another question I have, which I bet some of our audience members are thinking, often we have, civil society or advocates or activists who want the government to take action on some health issue, whether it's air pollution. Now, I know this came about because we have you, Luis, and a strong technical team in government that are championing, that are the champions. But when somebody's outside of government, how do you think they can convince government to take action on a health issue like air pollution or some related NCD issue? Do you have any advice for people outside of government how to create some momentum around their issue?
Just a minute, ele falou sobre.
Como que a gente poderia convencer as outras pessoas?
Okay. You mean
Fora da nossa realidade, né?
How can you use champions in order to engage and to convince people? Well, we are learning about this, but I think it's a day-by-day effort to, and I think the key component to have this is to be able to establish the relation between the problem and the consequence in the city. So this is the barrier that you have to face and you have to overcome, because if common people, if the residents, if they were able to understand that air pollution means having heart diseases and cancer diseases and
Respiratory disease.
so on and so forth. So I think this is the strongest way to convince people. This is our main challenge. And this, in order to have this, we need to put together specialists and journalists and technical people and politicians in a very how do I say this? In a very big effort to have this.
Yeah, you're coming through fine. Yeah, that I think you started off by saying that how do we make this into the daily life? How do we make this real in the daily life of the population so that they connect? Oh, that asthma attack that my kid have is related to air pollution, or the cancer, the lung cancer, or some other cancer may be related to the quality of life, and that when people connect their health with the air pollution, then or some other issue, then that generates support or interest in like a policy that will help protect them.
Sorry.
Cassiano, go for it.
The capacity of generate data about air pollution is a big challenger in Brazil. For example, we're not able to talk about air pollution in other states. because other states don't have the capacity of monitoring. We have only a reference station that feed us about the data related to air pollution. And now we have the low-cost monitors that make us able to talk about air pollution in the whole city. And I think that the big challenge to talk about air pollution in other municipalities or in other states of Brazil, this capacity of generate data about air pollution, it's a big challenge. With the low-cost monitor, if calibrate monitors, we'll be able to put the monitor in other state, in other municipality, and generate a light about this problem.
Great. And you mentioned that you thought one of the big takeaways was learning from other cities. But now other cities are also learning from you. You mentioned the Policy Accelerator and its successes. What are some of the lessons learned in this initiative, and how do you think another city could take this approach to their policy work or objective?
I think that work with the universities and is so much important for us, because in the most of times monitors was expensive, but it's the same. It is the same reality of the other cities, for example. And if you can talk with the universities, your universities, it's an example of a way to face the this challenge.
I think that's a very important takeaway. It's true. How you can first one is to design our policies based on evidences, and the second one is how you can translate a set of very complicated data. How can translate this set of data, technical data, into a very strong message to the population. So I think it's two very important takeaways, and maybe cities that are now trying to start this process, maybe they can put focus on those two topics.
I think that's a really powerful message. I know when we designed the Policy Accelerator process, it was to try and support cities in bringing those components together. I think a lot of times we see health departments or health policies understand the technical challenge, but maybe not the surrounding challenges, like building a supportive coalition, getting support. I'm sure that takes a lot of your team's time and energy, right? It's not just the data, it's also working with other groups. It's working with other departments and divisions to try and pull them along the process. And that kind of, sometimes we call those soft skills, right? Advocacy, leadership, public speaking are things that people have not planned for when they first think of a policy. So it's really impressive to see that your team has been able to pull off this. And I'm wondering, and we'll close this session a little early, even though this is very interesting. What do you see in the future? What are the next steps that you're looking forward to?
I think the next steps have to do with engage more and more the other departments and agencies, and creating like a team among the different secretariats and agencies, but having a team to keep this topic in the top agenda of the municipality. This is a in a more broad perspective. In a more real perspective, we have to finish our 25 low-cost sensors network.
Yeah.
And we have
Implementation.
to establish and to finish our strategies to communicate this to the population, the panels in the public spaces and conferences with journalists and so on and so forth. So we have this very well established in those phases that I presented before. So now maybe we are in the middle of the process, but as I said, we are very optimistic about the future.
Great. And if you're listening in live and you have a question, now is the time to ask it in the chat. You look in the chat bottom in the bottom. We do have a question for you. Somebody says, did you engage with the public during your policy development process? If so, when and how? And what are some of the takeaways, lessons you learned from engaging with the public?
Cassiano can answer, but
yeah,
as we don't have awareness about the topic, as the public doesn't perceive this is a real problem in the city, so it's difficult to engage public, but we have to keep trying to do this. But Cassiano can comment.
In the beginning, we start work with this policy, and after the worst moment of the pandemic. So, for example, when we talk about the health secretary, the health department, and I think that they were so tired of deal with the things about the pandemic, and but after a moment, we work about the data to create awareness in other departments. So when we talked again with the health secretary, they received the idea with more gentle, and they understand the importance of air pollution problem. I think that there is an aspect of this process that sometimes your secretary, your partner, and are not able to receive this subject. But if you show scientific estimatives, scientific arguments, you'll be able to convince, to create this sense of awareness in people and secretary and other departments, for example.
That's great. And I think you mentioned such an important element, which is that cities, governments are coming out of COVID, right? I mean, COVID dominated the health agenda for 2 years, and rightfully so, but now people are, governments are thinking about getting back to, a different agenda that's not so focused on COVID. It may have any COVID, some COVID components. And as a final question for me, do you want to talk about that, like how you navigated, ensuring that this was on the priority list as COVID was coming away?
Can you repeat, please, the connection?
Just, as Fortaleza was thinking about moving from focusing on COVID to other issues, what were the first steps to making sure that this low-cost sensor network and air pollution was, became top of the agenda?
Okay, and when we implement the network low-cost sensor, and then we generate data about their pollution, we relate this data about the health pollution with the help of the health secretary. We think that this is this is Fortaleza. How can I say? This is climb to the top of the agenda. We will be able to generate estimates with real data about collected and spread the city. The low-cost network will spread the city around the city, and we'll be able to identify hotspots, for example, and guide other policies, transit policies. We'll be able to create low-cost low emission zone, for example, and with these actions, and we will top agenda with the air pollution team.
But just to add a comment, I'm not sure if we can guarantee that it's going to be in the top agenda of the city in the next months and the year.
Yeah.
And I think it's the answer is strongly correlated to how population is going to understand this project, how the residents going to make correlation between this project and the life, the real life, the daily life of them. So if you get successful in communicate the project and to have population and residents having the correct understanding of the problem, maybe this will guarantee that you have this issue in the top agenda of the city. So I think that our awareness and population and resident support is the key element to guarantee that it's going to be in the top agenda of the city. That's our challenge.
Thank you so much. I think those are great concluding words. Do you have any other thoughts that you want to finish with before we close out this session?
Oh, just to thank you for all the support, and to highlight that for us it's very, very important to have this kind of opportunity to learn from other experiences, from other visions and specialists and cities. This keeps us moving forward. Thank you very much.
Well, I want to thank you, both of you, Luis and Cassiano. This has been really fascinating hour. And thank you for highlighting this, the complicated mix it takes to get policy passed, data and solid evidence-based policies and public demand or public support. That kind of, every health proposal really needs a mix of all of these in order to succeed. And I know that I'm sure that some of our colleagues watching now are learning from you, just as you learned from others. And one of the aspects of the Partnership for Healthy Cities that we're so proud of is that peer-to-peer exchange between cities. Like, we really believe that cities can learn from each other, and that's where real success is happening, when experts like you are hearing from real-world experiences of experts in other places. So I'm sure that you've maybe sparked a similar movement in some other cities. So thank you so much for sharing your experience. And we look forward to hearing more about Fortaleza's air pollution efforts in the future.
Thank you so much.
Thank you.